Good evening. Dr. M.J. Janaki College of Arts and Science believes in bringing experienced minds from the academia and industry to urge the importance of education and research. It is a pursuit that keeps our minds alive towards giving the best to our students. This webinar, organized by the Departments of Biochemistry and Microbiology, has brought together the great academicians to talk on Trinity of COVID-19, immunity, implication, and interventions. Yesterday, we had Dr. Gokul Shankar from the Faculty of Medicine, AIMS University, Malaysia, who spoke on importance of gut microbes. His talk was very informative and cogent. Today, we have his mentor, Dr. Gauri Shankar Rajam, a treasure trove of knowledge to talk to us on the immune system, friend or foe. It is always a pleasure to listen to Dr. Gauri Shankar, and he is always keen on sharing knowledge. I am sure all participants are eager to listen to yet another informative and interesting session. I thank our correspondent, Dr. Lata Rajendran, and Chairman Mr. Kumar Rajendran, whose aspirations for the students' welfare and faith in faculty have been strong and greatly motivating. I congratulate the organizers and wish the participants an enriching experience. Over to Dr. Lakshmi Priya, Assistant Professor, Department of Microbiology, to introduce Dr. Gauri Shankar.
Good evening and a warm greetings to everyone who have joined us for today's webinar. An inquisitive mind cannot be satisfied. It wants to see, feel, and learn every day. And this curiosity opens the door for research and discovery. The speaker for today, Dr. Gauri Shankar, formalized his curiosity and reached the pinnacle of his research career. After obtaining his doctoral degree in microbiology, he started his career in pharmaceutical marketing and later joined as lecturer in the Department of Microbiology at Manonmaniam Sundaranar University. He has 14 years of teaching experience and has guided over 70 students in their dissertation. He has presented and published over 100 research articles. His primary interest is to pursue research in the field of vaccine development and evaluation, and this passion positioned him at Center for Disease Control, Atlanta in 2003 as lab lead immunobiology laboratory, where his major role was to design, implement, and conduct studies to identify and solve public health problems with special reference to vaccine-preventable diseases. He has developed and validated immunological assays for various respiratory pathogens such as Streptococcus pneumoniae, Neisseria meningitidis, Bordetella pertussis, and Haemophilus influenza. He is a technical expert in immunology, in vitro animal assays, tissue culture-based functional assays, namely opsonophagocytosis assay, adherence neutralization assay, Luminex, MSD, ELISpot, PCR, and cloning. He is the much sought speaker and has delivered more than 30 keynote addresses in various national and international conferences held across the world. He has many honorary awards to its credit, and to name a few, recipient of the prestigious Young Scientist Fellowship Award instituted by Tamil Nadu State Council for Science and Technology, Government of India, International Emerging Infectious Diseases Fellowship in 2003 from CDC, CDC Director's Innovation Award for a novel Streptococcus pneumoniae common protein vaccine component. He is a member reputed scientific journals. He has 5 patents and has co-authored 4 lab manuals. He's an active member in many professional bodies like ASM, Southeast Branch of American Society for Microbiology, Sigma Z, and Association of Microbiologists of India. He's currently the Associate Principal Scientist, Merck, where he's currently working on COVID-19 and pneumococcal vaccine. Sir, we are all enthusiastic on immune system, friend or foe. Before I hand over the session to the attention of all the participants, kindly post your name and your institution name in the chat box. You can post your questions after 45 minutes from now in the chat box. The feedback link for today's session will be put up towards the end of the webinar. To the benefit of the registered participants who have missed the live streaming, the YouTube link for the webinar series will be active for a few days. Kindly make use of the link. Now I give you Dr. Gauri Shankar.
Um, thank you, ma'am. Thank you, Lakshmi. Thanks for the introduction. Thanks for the opportunity. I don't know how much I deserve befit this introduction, but like, hey, I'll take it. That's fine. Um, this is a great opportunity, and I'm also getting used to this new platform of teaching. I have been telling, I always tell that I'm a very, very traditional teacher. I love blackboard and love to just like a dirty my hand, and I love just the love a direct interaction with the student community. But like that energy is so contagious. That's where you just forget your age, you forget your your shortening telomeres, and basically like you just be very energetic. Yeah, but like, hey, things do change. Then we have to embrace change, and we have to just move on with the changes, and that's exactly what's happening now. And apparently, like COVID is basically like accelerating the changes. And hey, we are very resilient, so we will also increase our pace of technological evolution, and we will just catch up with that. And that's what is happening now. So this webinar, I was the purpose of this topic of like immune system or immunity, a friend or foe, is I'm trying to just give I'm also experimenting a different style of teaching, and rather than just discussing a topic on a very mundane, a very monotonous way. I was thinking about, okay, why not we just make it as a very like a sort of interactive, or more like a rather than a classroom. It's if it is going to be a courtroom session, how will it be? Like, if just imagine the setting is basically is like it's a courtroom where basically there is an argument between the immune system and the host, where immune system is saying like, hey, I'm your friend, I'm just doing everything to help you guys, because of me only you are surviving today. Whereas the human body or a host says like, come on, man, you are supposed to help me, but you are not helping all the time. Many times you think you are helping me, but you are hurting me. So that was the premise of the whole thing. Whatever I'm discussing, see, in this age of information, in this age of information or a knowledge explosion, every word I'm uttering here, you all know that. Whether the faculty or the students, you have access to the internet, you have access to every information available on the internet. So I'm not really just giving anything new, but what I'm trying to give you is like, I'm trying to give you in a sort of, I'm sort of packaging it, and I'm just presenting to you in a slightly different package, so that your interest is intrigued, your interest is tickled, so that by the end of the session, you may just like, hey, it's interesting, man. Why not we just take a look, get so do some more information, dig some more information on this innate immunity? Why not some information on cytokines? Why not some extra information on autoimmune diseases? If I had triggered that in you, I have done my job. If I have not done it, maybe I have a little more work to do. So with that brief introduction, I'm just going to take over the slide, and hopefully I will just keep your interest alive. Hopefully I will just I will just get you more interested in immunity or immunology. Or maybe I will get you more interested in public health, and maybe I'll get you more interested in being a responsible citizens. So with this, let me just go on. Hopefully all of you can hear me. Hopefully all of you can just see my slide transition. Can anyone just say like yes or no?
Sure, yes, sir. Slide there is, sir.
Slide move or Dalia?
Yes, sir.
And you can hear me clearly.
Yes, sir. Yes, sir.
Wonderful. Thank you very much. Okay, so obviously, like now the argument, the first person to argue is the attorney in favor of immune system, where immune system says, hey, I'm your friend. That is the argument. That's the first argument. And why? This is exactly lawyer is saying like, come on, man, I am giving you a wide spectrum of protection. I'm giving you like protection, physical barrier. I'm giving you a non-specific protection. I'm also giving you a specific protection. That's the reason why you are alive. And then basically, like as a representative of immune system, I'm just going to just like lay down like some facts for the court of law or court of human life to consider. Hey, I have an innate immune system. The first line of defense, we all know that it's a physical and chemical barrier, where basically like we just try to just keep the foreign particles away. Like physical barriers, you know very well. There is a wide range of physical barriers, like a skin, tears, earwax, mucus, stomach acid, etc. Like this also sort of combines the chemical barriers also, because some of them they have lysozymes. Even the acidity can actually like alter the pH, so that like that may become very non-conducive for some of the pathogens to survive. But hey, I do have a lot of barriers. I do have a lot of like a physical protection. But unfortunately, things do slip through. I can't help it. Some bugs can slip through, but I'm not giving up. I do have a sort of a second line of defense, like innate immune cells. Those innate immune cells, circulating immune cells, like macrophages or like Langerhans cells or Kupffer cells, all of them, they're trying to scavenge like a garbage man. They scavenge it. They just like put them away. But even then, so you know very well that there is a complexity of microbes. You have a variety of bacteria, virus, fungi, parasite, etc. So there is every possibility that one or more of those pathogens can escape these non-specific protection. I'm not giving up. Immune system is not going to give up. Immune system is not going to just pack their like a package and go for a vacation. I'm going to call for a backup. That's exactly where there's going to send signals in terms of cytokines, chemokines to the immune system, adaptive immune system for help. And of course, we have adaptive immune system. We have a wide variety of like members of adaptive immune system, like T cells and B cells, who are the major players. So basically, when the helper is going to call, obviously your immune system is going to respond to it. T cell is usually the one which is going to come immediately. T helper cell. That's why it is helper, and it is going to just like a cross check whether the foreign particle is genuinely foreign particle. It cross checks, make sure it is like a non-self. If it is a non-self, then basically it tells like B cells like, wow, good job, man. You just were able to identify that, and then it basically triggers like a cytokines. It may just provide some more CD4 cells. So obviously the cascade of adaptive systems takes place. At the end of the day, what happened? Like B cells, it basically just like a pins tags on the foreign particles, and these foreign particles now they are going to be effectively handled by killer cells. Like, like this is the argument. Jokes apart, we know very well that is exactly what is happening here. We have innate immunity, we have adaptive immunity, where in the case of adaptive immunity, it's a very highly specialized, highly specific immunity that involves the like individual and also interactive action of both B lymphocytes and T lymphocytes. It is quite complicated. I'm not really just interested in going into complication, because I'm here. I am trying to just like sort of prove the point that I'm doing a lot of benefit. I have a lot of tools. I don't have any hesitation to use the tools. I want to be very specific. That's why when I process the antigen, I basically like either kill it completely or present it along with the MHC. So this MHC basically is recognized by T cells, and T cells basically on the interaction would trigger and produce appropriate cytokines. Either it basically warrants TC cells, or it produces more cytokines for activating B cells, allowing B cells to undergo sort of affinity maturation or class switching, so that like the B cells that's producing IgM, now it just switches to IgG, and now not only IgG, even the switch basically generates more of a memory cells, so that future if the same antigen etc. it comes back, it's taken care. What exactly is the actual tangible benefits? Okay, it is very much quantifiable. You can just see here, like when there is a bacterium is there, I'm able to recognize, the immune system is able to recognize various motifs of the bacteria, various toxins of the bacteria, cell wall components, toxins, various antigens. I am having sort of a very diverse like a capabilities, where I can basically, the immune system can basically identify each component, and I can just respond accordingly, so that at the end of the day have effectively neutralized the virus, so that virus can no longer enter the system. I have effectively basically like, for example, if it is a gram-positive organism, look at the complexity. You should be able to appreciate the complexity and basically like sort of a ingenuity of the immune system. எப்படி differentiate பண்றது பாருங்களேன். Okay, it is a gram-positive organism. Wow. Okay, this fellow, he has got a very strong cell wall, which means I basically just a complement alone cannot punch the hole. So I need basically a more concerted effect. So what exactly is happening? The antibodies specifically just recognize specific receptors on the bacteria. Then basically it basically activates the complement. Complement basically activates the neutrophils or monocytes. So they all just come in there and they all just engulf the process of opson of exodosis, because they know very well that the cell wall is very, very strong. Hence, I basically need to engulf and digest. On the same token, I'm unable to use the same strategy for gram-negative organism, because unfortunately what exactly is happening is like gram-negative, even though it does not have a very strong PG layer, it has got multiple layers of cell wall, cell membrane. So this is big with so much of lipid there, the opson of exodosis is not that effective. So what exactly I'm doing, I'm just using a more complement as a more important mechanism than the effector cells. Smart, very, very smart. So from the point of view of immune system, it's like, hey, I'm just giving you a whole 9 yard of protection, right from the physical barrier to all the way to a highly specialized immune response with a memory response. If I am stimulated heavily, I know very well that this fellow is a bad fellow. So I would have to have have a strong memory. If the stimulation is not that bad, that strong, you give the insult is not that strong, system realizes that, hey, I have a limited memory resource. I cannot basically like exhaust the memory resource for some stimuli which is not strong enough. So it depends upon the stimuli, depends upon the insult, both the quality as well as quantity of insult. Basically, I just decide whether to have a immune response, whether to have a memory response or not. This is a very important point, especially when you are designing vaccine. This is a very important point where the vaccinologist just like may remember, they want to make sure that the vaccines mount quantitative and also qualitative immune response. That is the reason why the adjuvants are as important as the vaccine molecule, so that it would actually have a depot effect. It would trigger the anti-APCs and result in a lasting immune response. So that only when that lasting immune response happens, then that actually augments a sort of a memory immune response. So, Your Honor, case is closed. I'm your friend, no question at all. But hey, here comes. Now, Your Honor, you have to hear the other side of the argument also. That is in the favor of host. Hey, you're not just doing being a friend, but many times you hurt me. One simple example is allergic response. You really hurt me. You don't have to do that. But unfortunately, these anaphylactic reactions, who asked for it? It is an allergen. I'm inhaling a pollen. Pollen is just a dust particle. I need to sneeze and move on. That's all. Everybody does it. He is doing it. Why I'm not doing it? Because of your stupidity. Now what is happening? Your immune system is actually recognizing this antigen as allergen. Because it is more of a macromolecular in nature, then what happened? Oh, it's a big fellow. That means we have to just like recruit IgE response. Nobody asked for it. But unfortunately now the immune system, which is so-called friend, you call yourself friend, but you are no longer friend to me. Now you are mounting a sort of IgE immune response. So what's happening now? IgE simply just goes and basically just goes and deposits on the mast cells. And basically what's happening now, when this allergen basically like cross-links the mast cells, it's not even highly specialized effect. The cross-linking, you know very well that these are when you cross-link the receptors, the membrane basically just get disturbed. This disturbance is good enough for the whole cascade of mechanism to just get triggered. Now the mast cells is producing sort of a like tons of vasoactive molecules like histamines or more than histamines, leukotrienes. It is throwing it there. What's happening now? I'm having a vasoconstriction. I'm having a bronchoconstriction. I can't breathe. I have a diarrhea. Did I ask for it? It is like it's unwarranted. So I'm telling you, the court of law, this has to be taken into consideration that even though you have so many things in favor of you being my friend, but sometimes, my friend, you also happen to be my foe. Yep, you can see what all you can do. You can give me a lot of itch. You can just give itch. You can just contract my respiratory tract, so bronchoconstriction, asthma. I'm unable to breathe. Not exactly is happening in the US. That unable to breathe is for different cause. The reason is different. Unfortunately, you cannot blame immune system for what is happening in Floyd. What happened to Floyd? It is basically as a different reason. Whereas in the case of here, mast cells are responsible for bronchoconstriction in asthma. Blood vessel dilate. So more immune cells there. What are you? It's stupidity. On one hand, there is a bronchoconstriction. On another hand, blood vessel vasodilation, which means more cells go there, more mast cells go there, more histamines, more bronchoconstriction. Are you trying to kill me or what? Apparently, that's what is happening in allergic response. If it is a GA tract, I'm pretty sure Gokul Shankar would have touched upon it yesterday. Like in the case of GA tract, yeah, you tend to have you tend to overreact. Like it could be IgE mediated, or it could be even be a non-IgE mediated. What's wrong if accidentally a protein just leaks into the blood supply? Is it a crime? No. Apparently, for the immune system, it is a crime. Immediately you just scavenge it. Immediately you just mount an immune response, and here I have an allergic response. This is absolutely dumb. Then not only allergy, what about autoimmune? You are not supposed to recognize any of my own antigens, but you do. Like, see what exactly is happening. I educate. You are supposed to get educated. You are supposed to get educated where all your cells are supposed to be educated, both negative and positive. But what's happening? So what's happening here? Basically, no. If you fail to educate yourself properly, by failing to educate yourself properly, what's happening? Some of your warriors who are not supposed to recognize our own self antigens, they recognize. And what is the consequence? They recognize. That means the self antigens which are not supposed to be recognized are recognized now, and that leads to an imbalance. There need to be a balance between regulatory cells and effector cells. But if the effector cells are wrongly recognizing our own cells, then it is tipping the balance in favor of massacre. So I just get into I get an autoimmune disease like a type 1 diabetes, or like a myasthenia gravis, or like COPD, or some other like autoimmune disease. These are all not my fault. It's your fault. You are supposed to have the immune system is supposed to have a good control. Okay, we cannot just stay complaining the immune system. Of course, we do have strategies. We try to we understand that okay, the immune system can be sometimes stupid. They can be something. Sometimes it can be uncontrolled. It can just lose the balance. Then of course we have like a different approach to just supplement the regulatory cells, Tregs, so that like we can tip the balance back, so we are able to have better control, and we can have an attenuation of autoimmune attack. Of course, we are smart. We are able to just have our own control mechanisms, even though my own system is getting foe to me. Cancer. We know cancer has got more than one etiology, but again, this imbalance or overregulation. This overregulation can be a problem for me. Just give you an example. Hey, there is a tumor. I am trying to produce like effector cells to control the tumor, but for some reason, the immune system, I'm telling the immune system, like, why do you produce so much of suppressor cells? Why do you produce? Who warrants you to produce so much of suppressor cells? Unfortunately, most of the time, I have to give like I have to be fair. Okay, even though I'm attorney for in favor of human host system, still I have to be fair. Most of the time, you are balanced. You are able to just make sure the immune suppressor cells are actually kept under control, so the effector cells are able to just perform their function. Wonderful. That is the reason why the possibility of an individual having a tumor or cancer is very, very low even now, in spite of so much change in lifestyle, even in spite of so much like a stimulation. But still, when you lose balance, we are supposed not to lose balance. When you lose balance, what exactly happens? Tumor progress. When the tumor progress, then you know what exactly the additional complications. Hey, okay, I understand. As far as the immune system is concerned, we all understand it is overloaded. There is a lot of burden to the immune system. So we are trying to help the immune system. We are trying to supplement the immune system. How we are trying to supplement the immune system? Okay, okay, I'm helping you. I know very well that, for example, I know that IL-12 is very, very important interleukin that can basically augment, that can actually help in oncolysis. It can increase like oncolysis and recover the individuals. Wonderful. So what exactly I do? I just like in the laboratory, I just create an oncolytic virus. I just take for example an RSV or take a CMV, make it like a truncate the virus so that this virus is no longer like a virulent in terms of causing its own disease. Then what I do, I package the IL-12 gene there, human IL-12 gene there. So I just push it there. So I'm trying to. This is basically, I always tell this. I have told multiple times. As far as the immune system is concerned, apparently it is a number game. Apparently you're losing the battle. So we are what exactly? That's why the balance is tilting. So we are helping. I'm trying to help. The host is trying to help the like immune system by providing the oncolytic virus. So this virus is going to just go in, then basically just going to express the IL-12. There's going to be more IL-12, which is going to tilt the balance, more effector cells. That means the tumor progression is going to be stopped and there is going to be recovery. But man, you don't realize I'm helping you? What exactly you are doing? You are basically like just like you are just producing neutralizing antibodies. You are producing opsonizing antibodies. You are actually trying to sequester. Like sequestration is, I'm telling you, is one of the major concern. Especially the antibody sequestration is a very, very important concern when we are trying to have a maternal immunization. Okay, I'm just trying to trying to move away from this. I'm giving you a little more basis of maternal immunization. There are several infections where when the kid is born, the initial like a few days or for like first like a few weeks, the kid basically is naive. Kid has got basically has got no protection. So we just want to make sure that the kid actually has got circulating antibodies, maternal antibodies. That's the reason why during the third trimester of pregnancy, they actually give a TT vaccine. Similarly, now they are giving pertussis vaccine so that when the kid is born, there is a maternal antibody circulating. The downside is basically sometimes is that because there's a maternal immunity, maternal antibodies are circulating, when we give the vaccine molecules are again the proteins that are or more antigens that are recognized by those antibodies. So they can basically simply bind to them, sequester them, making them unavailable for APC processing. Hence, there could be sort of a immune blunting can happen. Okay, that's fine. That happens. We just can't help it. But in the case of cancer therapy, hey, I'm just giving you a sort of a winter important tool, and here you go. You are just messing up the actual like oncolytic virus, which you want to kill me or what? Okay, either you just block it here, or you are basically blocking a sort of inducing an immune response. One, you don't do immune, you just suppress the immune response, and you are creating problem. Okay, I am trying to overcome the problem by just giving you an oncolytic virus. Now all of a sudden, what you are doing, you are inducing more of an antiviral response. So you are blocking the oncolytic virus, making it basically useless, or you are just killing the viral infected cells so that there is a premature death of cancer cells. You are not allowing the virus infectious cells to propagate so that I can produce more IL-12 and this virus can just infect more cancer cells, and then that could be a very effective regression of the tumor. No, again that can happen. Okay, or basically a tumor induced immune, like you can block tumor induced immune suppression. So all of this basically like what happened is actually is they're all like they're all basically like a faults of a faulty immune response. Your immune response is not beneficial. Jokes apart, that is exact. These are the aspects that is being taken into consideration when you actually do a oncolytic virus therapeutic. So when we design oncolytic virus therapeutic, then we just take into consideration of all these aspects. Okay, what will be the fate of my like a drug which is an oncolytic virus? What is going to happen if it is going to be a neutralizing antibodies, etc.? So can I basically take the virus, truncate it in such a way that it will be immunologically less, it will be less immune dominant? So in this case, it is exactly reverse to vaccine. In the case of vaccine, you are trying to have your molecule highly immunogenic. In this case, I am trying to make sure like it is as blunted, as immunologically weak as possible, so that we can actually get rid of all these like a normal immune mechanism, so that we can facilitate the immune system to just recover properly and handle the tumor. So that exactly what is happening. So inflammation, this is basically like it is good and bad. Again, inflammation, it is again a balance. When you have effector cells or regulator cells are in balance, in homeostasis, beautiful. There is an immune response, there is an inflammatory response. It is a short burst of response, because you need inflammatory response. Believe me, you need inflammatory response, so that basically recruits molecules, that recruits immune cells to just effectively take care of the threat. But unfortunately, if the balance is tilted, if you have too much of effector cells and less of the regulatory cells, then it becomes hyperintense hyperinflammation. And that is a disaster. That can be fatal. But exactly what's happened. Like that is exactly the point. But immediately, what exactly? But the opposite layer, like opposite lawyer will say, objection, my lord, in favor of immune system. You are unnecessarily blaming the immune system, because it is not my fault. These are the factors. You have the stress, damage, injury, age. I have no control over it. When these things happens, cells get damaged, and the damaged molecules, like damaged dead cells or damaged molecules which are there in circulation, sometimes my system recognize it as like a for like alarmins. They are like basically like some cytokines can be recognized, broken tissue molecules can be considered. There are alarmins. Some toxic material is there. Some toxic event is happening. Am I fool? No, I'm. That's my job. My job is to sense toxic materials. Once sense the toxic materials, which are actually triggering an alarm system. That's why I call them as alarmins. These alarmins basically they trigger an immune response. That is my job. I just cannot keep quiet. You just drink a cyanide, and I cannot keep quiet. Like, oh, cyanide, then it doesn't matter. I cannot keep quiet. I have to respond to it. Then only I can save you. Hey, during the process of saving you, if something happens, that's not my problem. That's not my job. That's not my problem. But unfortunately, his argument is right. Like a human system's argument is right. Yeah, in the case of acute inflammation, like be it a trauma or allergic response or burn, frostbite, chemical. Yes, that acute immune response is beneficial, because it is going to just sort of it is going to recruit and concentrate more immune molecule to the exact site of action, so that I can have a very concentrated, very concerted immune response within that area. I'm almost like I'm triaging it. I'm making sure that this molecule, பழைய சினிமாலாம் அதெல்லாம் எந்த அளவுக்கு, I don't know how many of you are non-Tamil, but if you are on non-Tamil, I would translate that. Okay, in old movies, basically, whenever a heroine or hero is bitten by a snake, immediately there's this like hero will come, then he will just basically like will bite that place and will suck up blood. How I don't know how like practical or what, I don't know what is the scientific basis of it, but எடுப்பாங்க துப்புவாங்க எல்லாம் பண்ணுவாங்க, and then the heroine or hero will wake up. It is pretty much like they're triaging it. They are making sure that the poison does not just like get into the circulation. That exactly what is the benefit of acute inflammation. So I have to give a due, even though I'm just representing host as sort of like a defense lawyer, but still I have to just like give a due to the immune system, like that is very effective. But unfortunately, you are supposed to basically like do your job and disappear. If you don't just disappear, if you continue to just like insult the system, if there is going to be a chronic inflammation, then what exactly is going to happen? That's going to happen. Like it can give rise to neurological disease. It can give rise to Alzheimer. It can be a cardiovascular disease, etc. So I'm telling you, let's basically. I'm just going to. This is a very. I have just laid both sides, and here I'm just going to just lay one case where we have. I'm going to just lay this like a case study and leave it to the audience whether the immune system is friend or foe. It depends upon how you look at it. Okay, so this case study is very relevant to today's world. That is on COVID-19. Yeah, we see a friend, we see both sides of the immune system. We see immune system as a friend. Here you can just see here when COVID is there, spike protein is recognized. You know very well that COVID basically recognizes specific receptors on heart, lung, gut, and kidney. The receptors are basically like angiotensin converting enzyme 2 receptor, ACE2 receptor. And what recognizes the receptors from the virus point of view? It is the spike protein. Why it is recognized, why the SARS-CoV-2 spike protein is recognizing these ACH2? Because they seem to have mutated, so they have more specificity for human ACE2 than like other alternate host. That's why it's just coming and sitting here. It doesn't want to come and sit there. Please understand that it is interested in just being at bat and basically being in pangolin. And like if it cannot attach pangolin, if it cannot attach to rodent, it is going to just like be in the environment, and slowly, after all, viruses are basically the chemical moieties. They are just going to get just disintegrated, just go into the like nature. But unfortunately, you are you are in a wrong place at the wrong time. Who asked you to just like about to take this pangolin, keep just like keep butchering them because you feel like it has got like medicinal values? So the pangolin scales are supposed to be having a medicinal values. You just basically other பாட்டுக்கு ஓரமா கிடக்குது அந்த pangolin. அதை பிடிச்சு you just massacre, you just basically process it. And when you're processing it, you have got no PPEs, nothing. You are just processing it. The virus is all over the place, and wow, hey, I'm supposed to die, but look at it. I have an alternate host with whom now I can attach. Wonderful. Now fine, but still I understand. Okay, I just give a due to the whole used to human like immune system. Like I'm not keeping quiet when the virus comes and attaches to the gut epithelium or the lung epithelium. Hey, I have alveolar macrophage that is scavenging it, capturing it, basically, and basically providing the sort of information to the adaptive immune system. So with the help of various interleukins like IL-18, like etc., it is triggering a very, very nice normal immune response. So I'm your friend. I'm just warranting. I'm recruiting appropriate like cells, like a CD8 cells, then like other like monocytes, etc. So effectively kill it. That's beautiful. But unfortunately, what happens is like some factors can trigger. So, like for example, age, immune system has got no control. Smoking, yeah, you are actually digging your own grave. It's almost like Yana Tantalile Manna Podgrammar. You are just doing it. Like you could have your diabetes well under control, but or similarly like steroid therapy and all. What exactly is happening now? This is leading to hyperinflammation. When hyperinflammation happens, obviously there is going to be a cytokine storm. There is going to be more infiltration of more immune cells into the lungs. And if you're having more inflammatory response in lungs, you understand that lungs, which are supposed to be dry, they're supposed to just be beautiful place for exchange of gas. Now it becomes wet. When it is becoming like a wet blanket, it can no longer perform its function. It loses elasticity. It becomes more plastic, and it becomes wet. It cannot exchange oxygen. No gas exchange. That means the individual is going to suffer. When there is no gas exchange, obviously there is not going to be circulation of oxygen to the brain, and brain is not dumb. I'm going to just shut down. That's going to be a whole system shutdown. That's what is happening. So that's why COVID-19 is actually is a big pandemic right now. So what is happening now? Is it a friend or foe? But unfortunately, fortunately, like human life or human society, a scientific society cannot keep quiet. cannot basically like step back and ask the court of law to decide whether the immune system is actually like a friend or foe. We have to step in. We have to basically like, first of all save the host and then basically continue the argument. So how are we going to save the host? First of all, we need to know who is the actual problematic fellow. That is basically what's how we are fighting this like pandemic right now, with the better diagnostics, better treatments, and better vaccines. So as far as the diagnosis is concerned, you know very well that we use the molecular diagnostics mostly for isolating the virus. Like it's basically a PCR based detection system, where it could be a traditional PCR or it could be a lamp based PCR. Either one of them, actually, it's effective. We were able to detect the virus. So as we're detecting the virus, what exactly we are doing right now? We're also making sure, like the individual, we are able to alleviate the agony of the individual. That's why the prime main responsibility for the physician is to alleviate the agony by just treating the symptom. Okay, you are having body pain, you are having fever. Okay, I will give you paracetamol. Unfortunately, we are not able to use the non-steroidal anti-inflammatory for the body pain, etc., which is normally administered for this, because like brufen or aspirin, all those things, unfortunately sometimes they were seeing that they themselves can actually trigger like a mucus secretion, and they can trigger actually respiratory distress. So already you have a agent that is triggering respiratory distress. No point in having a medication that can actually amplify that. That is the reason why our choice or to treat fever and body pain, etc., is being very much limited to just paracetamol. But of course, we also have anti-inflammatory, where there's a lot of research going on using anti-inflammatory molecules, not non-steroidal anti-inflammatory, but like alternate to that, like trying to just use molecules, monoclonal antibodies that can block the receptor of IL-6, that can block the receptor of pro-inflammatory cytokines, so that there is no inflammatory response. Antiviral drugs, of course, we are trying to just supplement human immune system with antiviral drugs. But again, as I told you again, like oncolytic virus, we just want to make sure that the antiviral drug is not messed up by the immune system. We want to make so there is it takes time. It takes time for these like a research, just like a bear for a fruit for the effort. Of course, chloroquine, that's a very popular medication. Again, it's a big black box. We know it is available. It's available in the market. It is being used for malaria. It is being used to treat some of the autoimmune disease. But its actual value in the case of COVID is still a big question mark. There is, like, we know very well, in vitro, in animal models, it basically alters the intracellular pH. By altering the intracellular pH, it no longer basically it basically the virus is not able to just like uncoat. Virus is not able to just like propagate. Virus is not able to just reproduce. It's all fine. But in the case more in the case controlled studies, we are unable to just show the benefit of chloroquine. So it's a big question. Still, certain companies are actually pursuing it. Who knows? We don't know. Science is actually always sort of a moving target. What was like laughed upon yesterday, we no longer laugh upon it today. So basically, like tomorrow, who knows? Chloroquine could be the wonder drug for this. Of course, medications are available like remdesivir. Now, people I think COVID is we are able to get much better grasp on COVID, because yeah, we have a medication now. We have a basically antiviral drug, a nucleoside analog, which is available now, which has been it's been tested on other viruses. It's effective, and it is being tested on COVID, and it is effective. So it is what was in January or December, January, February. We are not there anymore. We are in a better position now. At least we have a medication that can basically help, especially when people basically, once they just go into the hospital, it's almost like a downhill. Once they go there, they don't go directly to the morgue. But now it's not happening. They are able to come around because of the remdesivir. We have a medication. So that basically is a sort of very good news for the public health. Another medication, as I told you, the anti-inflammatory, like IL-6 inhibitor, Kevzara. It's a monoclonal antibody that can block. Similarly to this company Regeneron, basically they are actually having another antibody. They're trying to generate the therapeutic that is a combination of antibodies. Some of them from humanized mice, and some of them that from patients recovered from COVID-19. They're combining it. This combined neutralizing antibody cocktail is theoretically it is supposed to just like help to treat like a severe cases of COVID. Again, why it's happening COVID? Is it because of our insufficient immune system or overactive immune system? Friend or foe, we don't know, but it's happening. Vaccines, yep, coronavirus vaccines are going in a big way. We have also sort of jumped into the pool last month. I think 15 days back, Merck basically announced that we were actually involved in a vaccine. We have research for coronavirus. We are like 2 vaccines and 1 therapeutic. I'm not like privy with a lot of information on that. Still, a lot of discussions going on. So I may not be able to provide you more information on these like molecules. Of course, this is what it is. Whether the immune system is going to be good or bad or not, as far as the host is concerned, hey, you stay safe. Like you just practice safe practices. Like keep a safe distance. Wash your hands very well. Have a cover your cough. Put a mask and be safe. That's what it is. Still, the question is, I like this is exactly my take home message. Basically, I always tell people, like especially who are in scientific community, we have a responsibility. We have a responsibility. Like there are so much of information overload. People just keep just like forwarding things left, right, center without cross checking it. If a fishmonger or a market person or a laborer who has got no formal scientific education is going to forward something, it's okay. But yeah, person with scientific knowledge, I think, should fact check before forwarding it. I just like a couple of weeks back, one of my colleague forwarded me a message saying that, oh, Japanese Nobel laureate, he says that COVID is man-made. It is made in China laboratory. If you just Google it, he himself has actually given a basically a disclaimer that it is wrong. He didn't give anything. Somebody has basically shown us it is a hoax. But I'm pretty sure like this one has been forwarded like several hundred times. That's a problem. We need to just like cross check. So the question remains, the immune quandary remains, whether friend or foe. Yep, I leave with this. I leave the judgment to you, whether friend or foe. But as far as we are concerned, like let us be knowledgeable, and as far as the present situation is concerned, let us stay safe. Practice social distancing. Have a very good, very safe lifestyle, and encourage or discourage marketing of wild animals so that they stay where they are. We stay where we are. So with that, thank you very much for the opportunity. I would like to thank the MGRJC and like all those participants. I really appreciate for your time. Thank you.
Thank you so much, sir. Truly a captivating presentation. Can you hear me, sir?
Yeah, I can hear you, and I see a lot of questions. Maybe like,
Yes,
if you are going to moderate the questions, that's great. Yeah.
yes, yeah. Only a speaker like you can liven up a webinar and drive the participants to a state of complete contentment. So the message is, as with so many aspects of human nature, the immune system can be paradoxical. This system might be the biggest fighter in the body, but sometimes it goes haywire. How and why they turn is often a mystery. Be it a body's friend or foe, the immune system continues to challenge and reward scientists like you as you delve into its potential to improve human health. Thank you, sir, for your wonderful presentation.
Mm-hmm. My pleasure.
We will now move on to the question and answer session. The first question is from Parameshwari Prateep. She's asking, can you differentiate between anaphylaxis and anaphylactic shock? And she has also asked, can you survive anaphylaxis without treatment?
Like I think it's a anaphylaxis. A differentiate between anaphylaxis and anaphylactic shock is pretty much like I think it's a textbook differentiation, like a immediate hypersensitivity and like a delayed hypersensitivity. So anaphylactic shock is basically something that happens in a few seconds. It's one of the common things with the penicillin allergy where there are incidences where basically like when an individual is given a shot of penicillin, before they just take off the syringe, the patient just goes into a shock. Basically, like shock is basically like the complete all systems shut down. Basically, it's very difficult for the individual to be recovered. As far as the second question, as far as the anaphylaxis, there's an allergic response. Sometime usually like first encounter could be a milder one, and subsequent encounter, it is similar like a vaccination. You are vaccinating with the wrong antigen, so it could be every consequent like an encounter can be much more insulting, and the response can be much more amplified, and it may lead to life threatening. Like can be life threatening. So the anaphylaxis slowly can just slowly move into anaphylactic shock if it is not properly recognized and properly controlled. Uh, can anaphylaxis or allergy can be handled without medication? Yes, initially if it is going to be if it is not every allergen is life threatening. Not every allergic response is going to be life threatening. So if we know that okay, I'm allergic to this, but basically it's not going to be life threatening, I can just I can not choose not to just do allergic like a medication. I can basically it's going to just like what to say. There's going to be symptoms. If you are willing to endure the agony, you can do that. If you can do that, like if it is a mild mild allergic response, mild itch, and you are okay with that, then basically so slowly what happened, your system would basically adjust. So it is a delicate balance how much you are willing to just endure the agony, and how what exactly is the extent of the immune response, the allergic response. So many times you just basically just allow the itch to go on, and then after 3 hours or after 4 hours it will subside. But if it continues, or a mild wheeze, there is a rain, okay, there's a mild wheeze, okay, you don't take any medication, try to relax, and then basically allow your system to calm down, to remove yourself away from the actually the triggering environment. And if you are feeling comfortable, that's fine. But you have suffered that 30 minutes, that is 60 minutes or so, you have suffered, but then you just recover. But you just continue. It's like என்னால முடியல என்னால. அப்ப I will just take a like Asthalin inhaler, or I go to the doctor.
Okay, sir. Thank you, sir. The next question is, can the truncated virus be used in treatment of autoimmune disease?
Yeah, it can be used. It can be used like as long as the analyte that is being expressed, like it's going to basically go and interfere with the receptor. So it can be used if autoimmune disease is basically like we are trying to block the antibody binding to the receptor. So as far as a truncated virus is concerned, I don't know. It's very usually the truncated virus is usually used to deliver a payload, and the payload usually will be an analyte, like an antigen. In this case, autoimmune diseases usually it is not the antigen that is a problem. It is basically it is actually it's a it's not a bad concept. You can basically make this virus to just deliver an antigen. Basically, again, it is not. It could be a sort of a altered self antigen. So it goes and sits on the self antigen antigen receptor, but still that interaction is not triggering an immune response, and then basically no antibody is produced. So it is possible. Okay, we can block it. Instead, if I can basically like produce something that where antibody is going to go and block that receptor, that is an alternate. So either we can use viral payload to just like deliver the payload of truncated protein, or it could be antibody. So theoretically it is possible, but practically it is much more convenient to just use a monoclonal rather than a truncated protein.
Thank you, sir. The next question is from Dr. Nitya. Can specific defect in interferon signaling pathway serve as marker for oncolytic virus sensitivity?
Yeah, I think as I told you, like IL-12 is a one important like a marker. Basically, like we have I think we have a molecule where it is basically like oncolytic virus viral delivery system where it delivers the IL-12 human IL-12 it carries your human IL-12 mRNA. So it just basically it basically translates and produce more IL-12 there, and basically that's our marker. And this basically we just the exogenous like IL-12 like a gene what we are saying, it has got couple of two or three like a base pair like altered, so it doesn't alter the structure of IL-12, hence it does not interfere with the function of IL-12. But basically we can detect what exactly is the expression profile, how successful we are. So we do like we can not only we can use the oncolytic virus with a payload of unique cytokine gene, but we can also basically truncate, we can alter it such a way that we can monitor exactly how it is expressing. I think that's exactly what is the question. I believe I answered the question.
Yes, sir. The next question is from Mamta Muttumani. She's asking, remdesivir was originally used for the treatment of hepatitis. Is there any relation between hepatitis and COVID-19?
Actually, like it's been like I think remdesivir has been used for more than hepatitis. It's been used for basically like Ebola. It's been you tested again RSV. So it is a nucleoside analog, and basically, in fact, like if I remember right, I think it is a more like it is presented more like a inactive form, and it has to be converted as active form in the host. So it has been tested, and apparently the remdesivir is very like a very resourceful drug, which is useful in more than one virus family. So I think it is effective, and it has been demonstrated to be effective. That's the thing.
Thank you, sir. The next question is from Ashwini. She's asking you to clarify on the controversial concept on plasma therapy.
There is, I think, there was some, especially when there was a report that there is a repeat infection in Wuhan, then people sort of like then there was like a big uproar that COVID, SARS-CoV-2 virus infections is not providing a lasting immune response. Hence, it could be short-lived. Maybe like the antibodies are not that neutralizing antibodies are not qualitatively great and all those stuff, because of the because some patient had a repeat infection. But later, I think in vitro studies very clearly demonstrated that the antibodies are good. They are very good neutralizing antibodies, and they are they're robust. The individuals do undergo class switching. They produce and also the affinity maturation. So the second generation, third generation antibodies are much more stronger in terms of affinity to the COVID. And that's the reason why now plasma therapy is really picking up. They are trying to just, I think that is going to be till we get the vaccine. I believe remdesivir has got a very limited availability. So plasma therapy is going to be one of the real cornerstone for COVID therapeutics. That is the reason why Regeneron is trying to basically see whether they can come out with a cocktail of the plasma from the COVID positive and mouse. So it is real, and that is going to be very beneficial, especially in patients who are really just like high risk patients who are hospitalized, who are trying to recover from that.
Thank you, sir. The next question is from Srishti Raja. Does multivitamin tablets help in building immunity during COVID-19?
Yeah, I believe so. I believe that there are reports that says the multivitamins, the vitamin B, and also zinc supposed to have some benefit in COVID, almost like trying to just sort of help navigate the immune response in a way, trying to tilt the balance in favor of the host. That's fine. Like unlike chloroquine, where we don't know the real benefit, as far as vitamin B's or zinc, even if they're not going to just give you like very tangible benefits, they're not going to hurt you. So I think it is sensible for us to basically, like, apart from exercise, make sure we do exercise and all those stuff. I think it is reasonable, sensible for us to just have a multivitamin, including zinc and other minerals. Yep. Anything else?
Sir, next question is, when will COVID vaccine development pipeline will gear up?
A lot of folks are jumping into the mix, including the Merck, and also the government, U.S. government is really just pledging fairly good amount of funding for this. So I just we are very hopeful that we will have a really a viable vaccine in the beginning of next year. So as Fauci was telling, like first quarter or second quarter, before in the second quarter of 2020, we should have a really a sort of a viable vaccine, effective vaccine for COVID. But by the time, most of the countries will have a lot of herd immunity. So at least the existing population will be immune, and new generation can actually will benefit from vaccine.
Thank you, sir. The next question is, we actually mount neutralizing antibodies against viruses. Why is that against this AC2 receptor, the neutralizing antibodies are not working, or is there any pitfall in this formation of this neutralizing antibodies?
See, the human system is smart. It has got ACE2 receptors are there for a purpose. So we don't want to really just block it. So we would rather block. We would rather basically rather than blocking the receptor, we are trying to just see whether we could just block the antibody in term neutralize. We have the neutralizing antibody to block the attachment of the virus to the receptor. That's the reason why we don't want to disturb the existing physiological condition. So we just want to leave it as it is, and we just want to block the invader. So if they see, for example, if I'm going to just use the receptor, there is going to be too much of bystander effect, and we don't want that to happen. Okay, that's an option. I agree. Like theoretically, I cannot argue with scientists like you. Okay, that is an option. We can basically go and block it. Like for example, in ulcer, when you're having an ulcer, basically that's what we are doing. We are giving an H2 receptor antagonist, or basically we are just going and blocking the receptor. So it is possible, but we just want to make sure, rather than trying to just block the receptor, which can lead to a blocking of receptor and in non-target cells also. If I'm going to target it to the virus, then that will be much more targeted. That's the thing. So theoretically, I think it is fine. Hope you understand my point.
Yes, sir. So the next question is from Ramya. A bacteria spends ATP very thoughtfully. Why our immune system invests so much of energy into inflammation and anaphylaxis or allergy?
Great question. It's a great question. There are more than one reason. There could be heredity. That could be the external factors. That may be just sort of that may be giving a wrong stimulation to the system. So our system basically is much smarter than bacteria. Or let's say we are all evolved from bacteria. So we are as smart as bacteria, or more smarter than bacteria. So we have a better control, but sometimes that errors can happen. So it is born out of error, and usually age, lifestyle, all those factors, they all compound to it. That is the reason why when you have a regulated system, in young age, when you are young, you are got a good lifestyle, has got a good gene, you are just basically you are not prone to any of these conditions. But unfortunately, either you are genetically predisposed, or you are in an environment where environment is pushing you, or a lifestyle is different. All of them, one or more combination, can actually result in tilt the balance between one way or other. That's the reason why there is so much research going on where basically they just ask you to meditate. That is to reduce the stress level. That can basically help to help to take care of some of the stimuli. Have your body weight under control. Then basically do regular exercise, good food, basically nutritious food or more than nutritious food, balanced food. All of these basically help to basically reduce the chances of these error. So it is basically error. That's exactly what's happening in terms of anaphylaxis or autoimmune disease. Yep.
Thank you, sir. Is the presence of ferritin is a very bad prognostic marker?
Yeah. Absolutely.
Thank you, sir. You want to add on to this, sir?
Yeah. I'm good, Ma. I think that's right. That's a known point.
Okay, sir. Thank you, sir, for your time. The development of diagnostics and therapy,
I didn't get your
which would
question.
be a for your patient answering.
Lakshmi, I lost you. I didn't get it.
Sir, question is over, sir.
Okay, great.
Hello. Hello, sir. Can you hear me?
Yeah, I can hear you, Ma.
Yes, sir. Thank you, sir, for your time and for patiently answering our questions. We pin our hope in the development of diagnostics and therapies, which will be a bright light cutter through the gray clouds of COVID. Thank you so much, sir.
My pleasure, Ma. Thank you for the opportunity. You all stay safe and have fun. Yep.
Thank you, sir.
I'm signing off. Okay.
Thank you, sir. Before we wind up today's session, I'll just take a few minutes to brief on the lineup of the program for tomorrow. Tomorrow, the first speaker is Dr. K. Padmavati, specialized in medical microbiology, currently working as Professor, Department of Microbiology and Co-Director, Research Laboratory for Oral Systemic Health, Sri Balaji Dental College and Hospital, Chennai. She'll be talking on SARS-CoV-2 and overview. The next session will be handled by Dr. V. Naveen Kumar, who's the founder and director of Imugenics Biosciences Private Limited. It mainly focuses on the development of rapid, sensitive, and cost-effective diagnostic kits for infectious diseases and antimicrobial resistant detection. He'll be sharing his insights on SARS-CoV-2 diagnosis and treatment. Thank you, participants, for all your time, and connect with us again tomorrow at 5 p.m. Thank you.